and can I ask a question?
Go
Sorry,
ahead.
it's Deborah here.
Hi, Deborah. Can you turn your camera on so I can see you?
There we go. Hello.
Hey.
So I'm interested. I'm particularly drawn to this rhythmic, the on-talking method. And I also have, I guess, a sort of a musical background. And, so that's undoubtedly part of, the attraction for me, sort of bringing in that sort of touch rhythm. And I wondered if there was any other aspect in terms of the whole method or process that you see a connection with sound, as well as the rhythm is very much the touch, the movement from heat to cool, those aspects. So I just wondered if there was anything else for you in terms of maybe sound.
I think that's a great question. So let me say a few things. In fact, let me demonstrate here. I'm not actually doing Facebook here with my phone, in case you can see me. I have an app which I use for clinic. It's just a metronome app, and I'm going to play that for you so you get a sense of what we're talking about when we talk about Manneka's meridian frequencies. So you should be able to hear a rhythmic ticking here. Now, I've got it relatively loud because I'm broadcasting to you guys, but in the clinic, that can be a very soft background sound. Now, I've got some ontake here, so what you would be doing is rhythmically applying heat in time to the beat. So there are several things happening now all at once. These anchors. First of all, there's a musical anchor, there's a sound. So your patient is hearing that ticking sound. And it's soothing. As long as you don't have some really horrible Casio type, kind of sound, then they're going to hear a very soothing ticking sound. Secondly, they're going to be feeling you tapping with the ontake or rolling with the ontake. So there's going to be a rhythmic stretching of the muscles. And then thirdly, there's going to be the smell of the moxa, and then there's the feeling of the heat. So all of those four things are combining in a very magical way to relax their muscles. And as soon as you've done it once, then it's going to happen again. The next time they come, they're going to be anchored to those feelings. There was a patient of mine, she'd just given birth, and she came to see me because she was getting mastitis from the breast pump. And I taught her to do ontake at home around the soreness, and it improved very, very fast. So just going around the lesion with the ontake to balance yin and yang. That's something that's in the book. And then she said, my son's got colic and he keeps burping. Can I do the ontake on him? So I said, yes, you can. So she started to do ontake on his tummy at spleen frequency. And then she came back and she said, Oran, I want to tell you something really funny. Every time he starts crying, so every time we get the ontake, we get a lighter and we light it. And now, after the third time, every time he hears the lighter, he stops crying. So the sound of the lighter was the anchor and then he knew that warmth was coming and relief was coming. He'd stop crying as soon as he heard the lighter, even before the metronome and even before the warmth. So that shows kind of on a very deep level how these sounds can have a healing effect. Thanks very much for that question.
Thank you.
Any other questions before we continue? Maybe
yes.
Yes, go ahead.
Can I ask a question? Hi, Oran.
Is that Sen?
Hi.
Yeah, hi.
You remember me?
Yes, of course.
Yes, I'd like to ask you a question. And that I learned theater before. When you channel palpation, the deal and jitsu, are there similarity within the deal and jitsu?
Yes, it's exactly the same kind of channel palpation. Perhaps in ontake, I tend to do a lot more stroking and less pressing than in shiatsu, because the palpation is very much on the the skin surface. But yeah, so you're very experienced, of course, with shiatsu, and so you can apply your palpation skills to balancing the channel in that sense, or to assessing the kyonjitsu in the channel. So yes, let me just say a quick few words about Toyohari. So Toyohari is a Japanese style of meridian therapy, and it's a school of meridian therapy that was originally for blind practitioners of acupuncture. So when the blind practitioners talk about the luster of the skin, they talk about it as something that they feel with their hands rather than something they look at. So they say, oh yes, this person, their luster is very poor, or oh, their luster is very good, and they're just touching with the skin. And usually they're just stroking. So you can tell when you stroke, if you stroke your own neck, those people in this seminar, you might feel that your neck feels a bit rough if you're tired, or you might feel it feels smooth. So maybe as just a quick experiment, whilst I'm talking, you could just palpate your own necks and just see whether or not it feels rough or smooth. If it feels rough, then we would say that's a little bit kyo, the luster is poor. And my neck is feeling a bit rough today, so maybe I'm a bit tired. But sometimes it will feel smooth. So if you imagine in very simple terms, the difference between palpating a teenager's arm and your grandmother's arm or your mom's arm. So there's a difference you can imagine right away in terms of luster. Also to look at, you can see that a young person has a kind of sheen or a luster to their skin that you can see, whereas an older person doesn't. So it's that kind of palpation I'm talking about, very light stroking. Thank you very much, Sam.
Thank you. Thank you.
Oran, there are a
good to see you
few
again
questions.
after all these years. Yeah.
There are a few
they
questions in the chat. Yes.
Yeah. Do you want to?
Yeah, sure. If you have some time, a few questions here. So one which says, how do you deal with fire alarms in the clinic?
Okay, that's a good question. I think one of the things that you'll discover about Ontake is it generates very little smoke. It's not like a Moxa stick, and it's not like burning cone Moxa. So if there's a fire alarm in the clinic, you're going to have to experiment. In the clinics that I worked in Malaysia, there were smoke alarms, but they didn't go off with Ontake. I didn't do any of that kind of burning Moxa on the end of the needle because I knew I would get the place into trouble. But when I worked in London, I worked in an alcohol project called Hernias Advisory Group on Alcohol, HAGO. And we had smoke detectors in each room. And what they allowed me to do is to get a cap, and you could put it on the smoke detector. But what we had to do, because of their insurance, is I had to sign the cap out at the beginning of the session and then sign it back in again at the end of the session so that I didn't forget to take the cap off at the end of the session. So it had to be very, very bureaucratized, and there had to be a protocol for it in order for them to be within the terms of their insurance. So that's what I would suggest to use to negotiate with your clinic around that. And for those of you without fire alarms, then this isn't an issue. You can try Ontake as well in your home and see how much smoke it generates. It's surprisingly little. And maybe when I do a demo in a minute, you'll get a chance to see that there's no plume of smoke coming up. Okay.
Thank
Another
you.
Question?
There are, a couple more questions, please. So there is an app for the metronome for these frequencies. Could you please remind us of its name?
Okay. You'll find all this in the book if you get the book, and you'll find. But the app is it's called Tempo, Tempo. The one that I use anyway, and it's by a company called Frozen Ape, APE. There are lots of metronome apps. This was one I was treating someone in the Malaysian Philharmonic Orchestra, And she said, Oran, I think your app is going out of time. And so sure enough, I was listening to it and said, maybe she's right. She said, look, you need to get this one. This is the one we all use in the orchestra. It's for professional musicians. But since then, I mean, that was 10 years ago, there are a lot of other professional apps. And what I would suggest, the criteria for an app is, first of all, you should be able to change the sound. So you should be able to go to a natural woodblock sound. And the other criterion is that you should be able to create playlists. The advantage of having a playlist is you can create a playlist called Large Intestine Frequency 108. And then you can have another playlist called Bladder Frequency 112. So you don't have to scroll manually between frequencies. If you want to treat gallbladder, you just click to gallbladder playlist. If you want to click bladder, you want to click to bladder playlist. So you can just jump from one to the other of the 8 frequencies for the 14 channels. So those are the 2 criteria. It doesn't have to be tempo, but it does have to have those 2 things in order to be really useful. If you've got one of those which is kind of like got a rounded thing and you have to, like a dial, and you have to scroll up to your frequency, it takes time. It wastes time in clinic, and you don't want that. Thank you.
Thank you. Another question here. Which is the best grade of Moxa to use in the bamboo?
Right, great question. So any medium grade Japanese Moxa, and I think so Wakakusa Moxa is what's sold in UK mostly. Wakaksa as the Japanese pronounce it. So, but I'm English. I'll call it Wakakusa, and it's basically a medium grade. It's the kind of Moxa that is good enough to use on the end of the needle without a needle guard. So it's relatively refined, but it's not good enough to do small cone moxibustion like the photograph of Junko doing moxibustion. The kind of Moxa that isn't good enough is the green twiggy Moxa that you get from from China. That's too. It's got too much particulate matter. So when you're doing kind of tapping techniques like this with Ontake, then bits will fall out. You want something that is relatively pure and hasn't got any bits of twig or leaf in it that are going to drop out and burn your patient. And I'm going to show you how to load bamboo shortly, so we'll talk a little bit more about Moxa then. One more question.
One more question. Can you use the frequencies with bioresonance magnetic therapy?
Okay, I'm afraid I can't answer that question because I don't know what bioresonant magnetic therapy is. So, yeah, I'm afraid I'm not able to answer that question unless that person wants to define it. But basically, I can share one thing. I think you can do anything with Manneka's meridian frequency. So there was a time with Stephen and I, we were experimenting. We had a light emitting diode, and we had diodes that emitted light at green, red, yellow, and we hooked those lights up to a metronome and we put them on do 14. So we were pulsing light without any sound at all at do 14 at different frequencies, and we were checking reaction points on the body, and we were able to get a very clear response just from the light hitting the point. So if you're emitting magnetic signatures and you're emitting them at a certain frequency, I would say yes, you can use those frequencies. Basically sound or light or electromagnetic radiation, anything will do.
Thank you. A question that we've got in the chat here, does this work for disc hernias?
Right. It works as well as anything for pain relief. Now, Ontake, particularly using the distal models with developed by Dr. Tan, so what I call Ontake 123, is brilliant for back pain and brilliant for disc hernias. So I remember I had a patient who I think was in her 8th month of pregnancy when she first came, and she had a lot of sciatic pain, and she really was in a lot of pain. So what we did right away was a Toyohari trick. I used zinc and copper on the master and couple points of the Dumai. So that gave her some relief. And whilst the zinc and copper was on, I started massaging along her arm on a related channel in terms of Dr. Tan's modelling, which was the lung channel. And she started to feel relief within about 20 seconds. So I kept going. She's going, God, why didn't I come and see you before? This is brilliant. So when she got up off the table, she'd only been in the treatment room for 5 minutes. I hadn't even really done much diagnosis, but she was in so much pain, I wanted to just kind of try and treat that right away. She said, my back pain's gone from 8 out of 10 to maybe 1 out of 10. So that happened within the first 3 or 4 minutes of the session. And so, yes, it's very good for relieving pain. Now, what effects it has actually on the disc hernia, I don't think I can tell you because no one's researched that. But certainly really good for sciatica, for back pain, or any kind of referred pain going down the leg. You can use these pain relief models that are described in the book very easily. Thank you.
Thank you. Another question here. Do you have any plans to teach in the UK next year, COVID permitting?
Yes. My very close colleague, Marion Fixler, we actually were planning to do it. Of course, it's been cancelled. This November, I was planning to teach in London. So I will be in, I've already got booked in France and Germany in late November and early December. So what we're hoping is that I can teach in London the week before that. So that would be the 3rd weekend of November in London. But at the moment, our venue is not taking any bookings because of the uncertainty. So they won't take any advance bookings for November 2021. So that's the first thing. The second thing is that I'm hoping to do, just during all of this madness in April, I was supposed to be teaching in Seattle, I think on May, it was May this year. So when all this started, then we had to pivot. So what we did is we managed to do an online course. It was 2 days of online teaching of Ontake, which actually got CPD points in the US. It was recognized by the NCAOM as the first practical course that they've actually recognized. And now that's going to turn into an on-demand course, which we may also, there are possibility to distribute that, which it may end up on the Balanced Healthcare JCM website through Net of Knowledge. So all of that is being kind of negotiated at the moment. So there may be online learning for Ontake that you can get here via JCM and Balanced Healthcare and Net of Knowledge, or it may be in the US, that our course is just limited to the US and you have to register with Geological in the US. And I certainly hope to come to UK at the end of next year, if we're lucky. Fingers crossed. Thank you.
Thank you. Fingers crossed you will be here. Just one final question, Oran. Are there some cases that you really don't recommend doing this?
Yeah, so when people have open skin lesions, I think that's the main contraindication for Ontake. So, supposing you want to, this person's got sciatica, but then when you look at the lung channel and you want to treat the lung channel to treat the sciatica, I won't go into the logic of why that is today, and you find that they've got some kind of skin lesion there, like open wounds, then you can't apply Ontake there because there's no way to sterilize it after that. So, so anywhere there are body fluids, blood, so you don't use Ontake after you've done bloodletting. You don't use it when there are weeping skin wounds or lesions which are open. That's the main contraindication for applying Ontake. Having said that, it is very good for psoriasis and eczema, but if you tap around the lesions rather than on them. So we think of, if you imagine my hand as the skin lesion, then that's kind of red and raised and inflamed. So that means it's very jitsu, it's excess. So that means that the borders are deficient. So if you tap around the borders with the ontake, in Japanese thinking, you are treating the deficiency, which in terms of yin and yang, will then reduce the excess in the middle. So I think in the book I described case history of someone with allergic dermatitis, and she had it all over her face and all over her back. So I did root treatment with Toihari, which kind of calmed her down and balanced her pulses, and I did branch treatment with ontake, just tapping around each lesion every time she came, and that constituted 100% cure. It just disappeared.
Sorry, just 2 more questions, Oran, very quickly. One, how long do you tap for?
Okay, that's a good question. I don't know how many of you learn, in your early days of college, you learn to do Swedish massage. And when you do massage, it's like a routine. You do effleurage for a few strokes, and then you do petrissage, and then maybe some friction. And it's like a recipe, isn't it? It's like a prescription. You kind of do a certain amount. And you're not, and a lot of masseurs who I go and see, say, when I was living in Malaysia, were very prescriptive. They would just kind of do a routine. Ontake isn't like that. Ontake, the goal of ontake is to balance kyo and jitsu in the channel. So when you feel that there's been a change, you move on. So if I'm treating the lung channel and I feel that this area is soft and this area is excess, or maybe I'm working on large intestine channel, for example, and I feel the area around large intestine 6 and 7 is deficient, and large intestine 10 and 11 are very painful when I press, and I start to tap on large intestine 6 and 7. If I then press on large intestine 10 and 11, and I find that they've changed, then I've done enough. I can move on. So it's not like, oh, you have to roll, 20 bars on this one, and then you have to do another, 30 beats on this one. You don't have to do it like that. So as soon as you feel change, you move on. Because if you regulate kyo and jitsu, yin and yang in the channels, then you are regulating kyo and jitsu in the body. And the body will regulate itself. It's like the doorbell I was talking about earlier. When you ring on the doorbell, you send a signal to the inside of the house, and then someone on the inside of the house comes out and opens the door. So that's what you're doing. And you're doing this you're treating lines and you're treating regions. And that's a very different kind of messaging to needling a point or to doing small cone moxibustion on a point. And it's a very dynamic way of talking to the body. So you'll see these changes happen. And, ontake is like a super mobile Moxa box. You can treat the whole back in 5 minutes. When I will put some links into the email that I send to subscribers, which will kind of point you to some of the things we've been talking about. So stuff about loading and lighting, stuff about treating the back, so you'll get to see how to treat the whole back, and some other links and videos that I'll send you links for.
Can this be used on animals?
Absolutely, yes. There's someone in our Facebook group who's a vet, and he is always posting the cutest videos of him treating horses, donkeys, dogs and cats with ontake. And he ignores my advice, and he uses a metronome with a kind of really horrible Casio sound, and the dogs just look at him mopingly and lovingly, and they love it. I've used ontake on a friend's dog and on my own cat. She's not very keen on it, but the dogs absolutely love it. Yes, you can absolutely use it. I think you just give them some time to accustomize to the smell and to the sounds. Keep the sound low. That's another really good trick to remember with the metronome. It should not be jarringly loud. It should not be the main signal in the room. It should be in the background. It should be very quiet. So this tick, tick, tick should really be somewhere subliminal, enough for you to hear it and enough for your patient to pick it up. But it should not be like Big Ben chimes taking over the room. Same with animals. It should be a gentle sound.